Hello, everyone, and thank you for joining us today. We're going to get started in just a few minutes and let everybody get a chance to log in. Hi, everyone. Thank you so much for joining us today. We're going to get started, and I will hand it over to ASH Managing Attorney, Kelsey Romeo-Stuppy.
Hello, everyone. Thank you for joining us today for our webinar on combating tobacco industry lobbyists in public health. We have 4 great speakers today. I'm really excited about this webinar. We launched our updated data for the tobacco lobbyist tracker yesterday. So we're here today to discuss why and how we should combat tobacco industry lobbyists. So our 4 speakers are Doug Matheny, the Programs Manager for State and Local Policy at the Oklahoma Tobacco Research Center, Annie Tegen, Vice President of State Advocacy for Campaign for Tobacco-Free Kids, Meredith Berkman, Co-Founder for Parents Against Vaping E-Cigarettes, and Nichelle Gray, Manager of Engagement and Special Programs, Action on Smoking and Health. Before I hand it over to them, one quick housekeeping measure. We'll do our Q&A session at the end. So if you can please click down at the bottom and put any questions that come up into the Q&A box, we'll have them all ready for us when we're ready at the end. So with that, Doug, I'm going to hand it over to you. Doug, you're muted.
Well, here I am. Can you hear me?
Yep, we can hear you.
Okay. All right. Sorry about that. I went to my screen sharing and lost Zoom. Still on mute. So thanks for this opportunity. This is it's just an oversimplified flowchart of the major problem that we're going to be talking about today. So basically, from left to right, we have the lawmaking process, then we have tobacco industry interference that interrupts that process, interferes in it. As a result, we have effective bills that are killed, weakened, or delayed. Often we have legislation that is enacted that's of the industry's own design. And as a result, we end up with preventable disease and death in much greater numbers than need be, of course. So why shine a light on this? Why shine a light on tobacco industry interference and tobacco lobbyists in particular? Number one, the tobacco industry aggressively promotes tobacco use, the leading cause of preventable deaths in the US. The most effective tool for reducing tobacco use, of course, is public policy. The greatest barrier to effective public policy is tobacco industry interference. And finally, exposing tobacco industry interference reduces its influence and therefore improves public health. The quote on the right is from a document in the 1990s, but I think it's still largely the attitude of the tobacco companies today to a large extent. That is that they aren't concerned so much about public opinion and media coverage to the extent that they don't affect the government. They're only concerned insofar as they do affect the government. They recognize they're not likely to be liked, and what they want to be is ignored. So that's another reason in and of itself to shine a light. And I just am trying to advance to the next slide here, hopefully. Sorry. Let me try this. There we go. So Nichelle later in the webinar will be offering an overview, kind of a walkthrough demonstration of the entire website that Ash is launching today. But I'm just going to go through kind of the top level summary findings real quickly, just to kind of present what is out there on the website in very short form. Again, there's going to be a lot more detail offered later. So we ended up with, after this year's analysis, we found 927 state level lobbying registrations this year, involving 856 distinct lobbyists and lobbying firms. Almost 2/3 of the registrations that we found represented a company that's owned or has a licensing agreement with adjudicated racketeers. These include Altria, Reynolds American, and Juul. Altria alone had a total of 293 registrations that covered all 50 states and DC. Reynolds American had a total of 189 registrations covering 49 states and DC. The states with the most tobacco industry lobbying registrations this year include Pennsylvania with 64, Florida, New Jersey, Texas, Colorado, Ohio, Virginia, Maryland, Missouri, Kentucky, and Georgia. Those are the top 10 with a tie for number 10 there. Since 2001, the first year that the tracker was put together, we can see that the number of tobacco industry lobbying registrations decreased in a total of 27 states. It increased in 17 states and was unchanged in 7. Overall, state-level tobacco industry lobbying registrations decreased by 74, from 1,001 in 2021 to 927 in 2023. Most of this decrease was due to Juul, which had 43 fewer lobbying registrations in 2023 than in 2021. Swisher International and Swedish Match each increased their total lobbying registrations between 2021 and 2023. So I wanted to go over just very briefly some of the methods and limitations for the tracker. The information was obtained by visiting the lobbying registration websites for all 50 states and the District of Columbia. Public records were searched for tobacco companies, trade associations, and retailers with currently registered lobbyists or lobbying firms. You can find a full list of the keywords on the website. Then for each tobacco industry organization identified, the names of all lobbyists and lobbying firms registered to represent them were tabulated. Because some lobbyists and lobbying firms register to represent more than one tobacco industry organizations, the total number of registrations were also tabulated. A very important limitation to mention is that in 12 states and DC, lobbying firms are allowed to register instead of individual lobbyists. As most lobbying firms employ multiple lobbyists, the total number and names of individual lobbyists representing the tobacco industry in these states could not be determined from public records. I wanted to finish my little part of the webinar by just reminding everybody about the racketeering verdict. The issue is not really about lobbyists or lobbying, it's who the lobbyists represent. Under the federal RICO law, prosecutors had to prove to the court that the tobacco company's organized conspiracy to commit fraud was likely to continue indefinitely into the future. Indeed, the tobacco industry has continued to mislead lawmakers, and by extension, mislead our laws. Internal tobacco industry documents show that they wrote or heavily influenced many state laws still in effect today. So starting July 1, just next month, coincidentally, court-ordered signs featuring 17 corrective statements will be going up in stores that have merchandising agreements with tobacco companies. All 200,000 or so of these affected stores must post the signs no later than October 1 of this year and display them for a full 21 months. The signs offer factual information that's relevant to public policy. But the corrective statements are not enough. Corrective actions needed. These court-ordered signs that will soon appear in every community across the country could be used as a fresh opportunity to raise awareness of the racketeering verdict among lawmakers and their constituents. So thanks. I'll turn it over to Annie.
Great. Thank you so much, Doug. That was great. I'm excited to dig into the tracker myself. So I just have a few slides to keep us going along. But again, my name is Annie Tegen with Campaign for Tobacco-Free Kids. And we work on a lot of campaigns across the country with many of you that are probably on this call. And so Ash asked me to just share a little bit about industry interference that we saw at the state and local level, and specifically with paid lobbyists, industry lobbyists. So, this slide you may remember from the movie Thank You for Smoking is typically what we all think, tobacco industry lobbyists look like. And some of them do, but they come in all shapes and sizes. But what I wanted to make note of is that our side has lobbyists too, often. So I know industry lobbyists are often extremely influential and powerful. But I wanted to just reiterate that our side, we have good lobbyists too on our side, public health lobbyists that we often hire. Oftentimes we don't have money to hire the big bucks hired guns that the industry uses with connections, but we do hire them as well ourselves, and have some really passionate, wonderful people that we work with on the public health side. So, this is just sort of a visual. When I think about tobacco industry interference, I think about an iceberg, and I think about the fact that, the industry interference, lobbyists are kind of one of the only visible things that we can see, but there's a lot going on under the surface and that we can't see. So this tracker is one way to kind of expose what's going on, what we can see and what we can find. But the real nitty gritty stuff often happens behind closed doors and through AstroTurf and front groups. So they asked me to just share some local and state examples. So I just have a few. For example, in Denver, the chief lobbyist for Altria happened to be, best friends, BFFs with someone on the Mayor Hancock's chief of staff, or Mayor Hancock's staff. So ultimately, that really had an influence on causing the mayor to veto an ordinance that had been passed through the city council. So sometimes those relationships and those personal connections that the industry hires and literally buys can really make or break. They hire people that already have these instrumental connections and really close ties with elected officials. So they can buy the best because they have unlimited pockets. So there are other examples of, for example, in Los Angeles, some of you may have been at that meeting, but there was a city council meeting a couple of years ago when we were working on a flavored tobacco ordinance in Los Angeles, where, the RJR lobbyist, she was kind of walking down the halls, and you could just see her walking in and talking to folks. She was walking and talking to one of the pastors that was kind of on our side, talking to him, confusing him a little bit. And I just remember I have this distinct memory of her talking about how she prays with her family. And she was talking to this it was just really sort of disheartening to see. And it just seemed so disingenuous and really definitely got our side fired up. But ultimately, they not only do these lobbyists work directly with, city council members or state legislators, but also with other folks in the community. And oftentimes there are other strategies that they use, including, actually paying other community members to attend a hearing, to wear a certain T-shirt. So it goes kind of beyond just what they do as lobbyists when they're behind closed doors or testifying. A couple other examples are some RJR lobbyists that really influence policy in an unfortunate way in other cities in Colorado, in Salida and Boulder. There's one particular lobbyist that really dug in and had some really strong connections and was able to get certain ordinances from being heard at all. So sort of just stopped everything dead in its tracks because of their connections. So again, these are hired guns and not necessarily. Well, I'll stop. I won't say what I was going to say, but I really think it's important that we have this tracker and this information so that we can expose everything that we can about what the industry is up to. And oftentimes, these lobbyists will want to meet with us, and we are coming from a position where we don't negotiate with the industry ever, but oftentimes that's one of the tactics that they will use, is to try to get us to compromise and to come together, in a legislative office or something like that to meet together. So they're certainly up to no good, but I just wanted to point out a couple of other things that we've seen, sort of tangential to the lobbying work. Certainly there are AstroTurf groups that many of you all already know about. I mean, back in the 90s, there was the National Smokers Alliance created by the industry. And then there was a Switch network with Juul, and there was, in California, we saw Neighborhood Forward, which is sort of an AstroTurf group from the industry. And there, and other strategies that industry lobbyists push forward, but you'd never really know that they were behind them. This is a photo I just wanted to share as one of those examples. This was the California bill to end the sale of flavored tobacco products, including menthol cigarettes, was Senate Bill 793. And this is an example of how the industry and their lobbyists organized a fake protest, and calling the Senate Bill 793 racist for bogus reasons. And it was sad to see that, and these folks, our lobbyist actually was able to follow the trail of the folks who are getting paid for showing up at this protest, and basically just handed cash. So I have some other examples of other things that the industry has done. They're less related to lobbyists, so I'll skip over them. But I guess I just wanted to end by saying that these are kind of the real lobbyists that have the most, we believe should and do have the most influence. Some of them, yes, are paid lobbyists on this page that you'll see, but others are, I consider us all to be lobbyists and advocates. We just need to speak up. So I think the one thing that the industry does have is money, and certainly they can pay as many lobbyists as they want, and they can pay lobbyists with the right connections, but they don't have the community behind them. So as much as they'd like to create an AstroTurf, fake group, pretending that the community is behind them, we have the real folks, and the folks who are probably present on this call, who always want to advocate for kids and for public health. So you are the real lobbyists, I guess I would end with. And I think I'm going to turn it over to Meredith.
Thanks, Annie, and Doug, and thanks to the ASH team for including me today. I have been so excited about this webinar and so excited about this resource. I look bad because I don't have slides, but I will give you just a few examples. I think we all know why this tracker, this resource is really important. And I come at it from a slightly different perspective in that, for those of you who don't know me or don't know the group that I co-founded in 2018, and by the way, I'm very happy to be wearing my Mom Against Vaping sweater, though I need to get a second one that says Mom Against Tobacco, because though we are Parents Against Vaping e-cigarettes, we are focused on fighting all flavored tobacco products and the predatory behavior of the tobacco industry. And that's why I think I've been asked to talk a little bit today. But our leadership, including me, and our power, or volunteer power, the key word there is volunteer. And the reason for that is we understood very early on, when we discovered that a Juul representative had come into our kids' school in 2018 and told a group of 9th graders, including my son, that Juul was totally safe. We discovered within 24 hours it was a Juul rep, et cetera. But what we understood was just how insidious Juul was. And as we learned more over these last few years, just that kind of duplicitous behavior is what defines this industry that is profiteering by selling its poison. And so we feel that, there's no amount of money that the industry could ever spend that could drown out the authentic voice of a volunteer parent who is speaking against the tobacco industry on behalf of protecting their own children and everybody else's children. And so that's sort of been our model. And I'll give just a few examples. My own background before this was a journalist. I mean, I took 20 years off to raise my 4 children. That got me into this space, my son. But I try to think about, and I would say that I think the more that we in public health spend some time, thanks to resources like this, thinking, what would the industry do? Now, obviously, we know what the industry will do. The industry will use its tobacco products to addict, for example, a new generation of kids to nicotine because their customers die. We all know that. That's old news. And I'm not suggesting that we want to be like that picture from the movie. Actually, Annie, I am so appreciative of your including that in your slides. Thank you for smoking. I just read the book, which I had never read. And it's let's call it a hoot, but it's also, it really sheds a very bright light on what we see continuing, which is the industry's use of lobbyists and paid surrogates to convince legislators of supporting their agenda. So I'll give a couple of examples. Very recently, I was contacted by someone from a group called Ferox Strategies, F-E-R-O-X. First, a very close partner of ours was approached by Ferox Strategies about a bill in Congress, this is at the federal level, that was calling for a ban on all flavored disposable products, big products. And then my partner, unwittingly, not knowing who, what Ferox was or who it was, said, oh, well, have you talked to Parents Against Vaping? And the person hadn't. So they reached out to me. And it was very clear very quickly, that, and I was going to read, basically this group, Ferox Strategies. I then went on one of my favorite websites, opensecrets.org, and I looked up, now I had this existed recently, I wouldn't have had to do that, but I looked up Ferox Strategies and I looked at the publicly available information, which for the first part of this year of who Ferox Strategies was paid by, and what a surprise, it was Reynolds Tobacco. And you think, really? Reynolds Tobacco has a pro-public health agenda? No, Reynolds Tobacco is, and we have seen this over and over lately, that the industry is pushing legislation and pushing the narrative through paid surrogates, writing articles that say, if we could just get rid of flavored disposable vapes, we could protect the public health of our children. In fact, in one of the letters I received, this person from Ferox Strategies was so helpful that she offered tweets that we could use in support of this bill that Reynolds was looking for support for. And the tweet, I think, was, it's time for the US and FDA and Dr. Califf to act in the best interests of our children. We can't allow companies to exploit our youth, et cetera, et cetera. So in 2 seconds, it was very easy to discover that this was an industry-backed lobbying firm. And in fact, for me, it was fun. I felt like I was picking, what is that terrible expression? Picking the wings off a fly or something horrible like that. But I wrote and I said, I am so grateful that you reached out to us on this. I'm just curious, Ferox Strategies, who's your client? And funnily enough, I never heard back from them again. So I think that's a pretty obvious example. Another example that I think I'll give is something that is tangentially related. And I've talked a little bit now, with Ash about this. It is remarkable to have this resource, right? To know who the lobbyists are. There's nothing illegal about these lobbyists and hiring of these lobbyists. we all understand that what these lobbyists are pushing for is something that we feel is immoral, which is the profiteering, not to say they're immoral people, but that the profiteering of the tobacco industry and the use of obfuscation through lobbyists and other surrogates is immoral, but it's unfortunately not illegal, which is why it's so great and important for us to have this resource. We always have to be thinking and be aware. I recently read several amazing editorials that seemed so focused on protecting kids' public health by getting rid of disposable vapes. Well, I'd love to get rid of all flavored vapes, but I also understand as someone in public health that you can't piecemeal it. We have to get rid of all flavored tobacco products. And I noted the name on at least one, maybe even two of these articles over a short period of time. And they were someone that was familiar to me. In fact, he is someone that is a paid surrogate for the industry, who, if you looked at his byline on some of these articles, it doesn't mention that. That's one thing I hope can be added to resources like this. The names of people that we know are, and the names of groups that are receiving money from the tobacco industry. You know, as a partner said to me this morning, and I think we all know, follow the money. So another example, we were and we remain, and Annie will know this well, very involved on making sure that both New York State and New York City, and I'll speak for the moment about the New York State issue, ends the sale of menthol cigarettes and all other flavored tobacco products. And this was something that the governor of New York had wanted in her budget. And for political reasons, unfortunately, that piece of it, there were some things that worked out about e-cigarettes and taxes, but not that piece of it. And I noted that the New York State Sheriff's Association, or I believe it was the New York State Sheriff's Association, was talking about, was opposed to the menthol part being included. And I said, gee, I wonder what that's about. So, you know, we should all be thinking this way. So I went on the website of the National Sheriff's Association, and, you know, we should, when we see a group that is calling out something that for us seems in any way suspiciously pro-tobacco, anti-public health, well, sure enough, I noted recently that I couldn't find it again, but I found that one of its corporate partners was Reynolds. And so I think we have to be very mindful whenever something seems too good to be true. When we're talking about dealing with the tobacco industry, it likely is, meaning there's a hidden agenda. And I think the example, the federal example that I just gave, suddenly, you know, and I know Doug mentioned this, you know, Reynolds, I think, put out a citizens petition about ending sales of disposable flavored vapes. And there are a lot of articles out there. We have to call out when, for example, let's say there's an article that's anti-public health on the tobacco issue in any publication. I've seen that in several very respected Washington-focused websites and newspapers. And when you do a little bit of a deeper dive, several times, I know, you will see that the person has an affiliation to an industry-funded group that is not part of their biography at their bio at the end, you know, where they have their byline and say their affiliation. And so several times working, in fact, I've done this with Annie's colleagues at Tobacco Free Kids, you know, and gone to the media people and said, you know, we have to call this out. And so the more that we can do that, the better. I'll give one more example that's not specifically about lobbyists, but somewhat related, I think, and very powerful. I know so many of us on this call were really focused on last week for World No Tobacco Day. And the day before that, so this was May 29th, was the day before World No Tobacco Day. There was a big piece in the Financial Times, and the headline said, Philip Morris on path to becoming an ESG stock, says chief executive. And ESG is a reference to environmental, social, and governance. And this I'm going to have to credit my partner, Rebecca Brown at Tobacco Free Portfolios for this knowledge. I didn't have this on my own. All I knew was it made me want to vomit that the head of Philip Morris had the nerve to green and purpose wash and stand up there and say, World No Tobacco Day is coming and we should be considered an ESG stock, meaning, you know, for those are like the stocks that are agreeing to live by these principles of, you know, environmental, social, and governance. Well, as Rebecca informed me, it turns out that the godfather of ESG, a man named Robert Eccles, Eccles, who's incredibly well respected, and you can go on his website, where you will not see that he had been hired by Philip Morris to advise the CEO. I found that in a couple of articles. It's not on his website. And so Philip Morris, I'm sure, is paying a pretty penny for the father of ESG to take him around, I assume, to different financial leading organizations and say, don't not invest in us because we're on the road to becoming, you know, a socially acceptable and ESG stock, as opposed to, hey, we paid this guy who created this good guy idea to help purpose wash and greenwash the fact that we're poisoning people and preying on vulnerable populations and priority populations. And I'll end just with this. In Washington recently, a partner and I and my colleagues and I met with a Congress member from the Bronx. We came to talk to him. He's on the China Select Committee, and we were there talking about, you know, wanting FDA to be held accountable for not using its authority at the border to with the Customs and Border Patrol as a partner agency to keep out these Chinese unregulated products. And he, I thought, so beautifully said that when tobacco industry lobbyists come to see him, he listens. And his response, he said to us, is, don't insult my intelligence. Do you think I can't see right through you? So he's now my hero. And also, so are the people at ASH for creating this really fantastic resource that I will spend, I'm sure, many an hour late at night when I can't sleep going through and cross-referencing. And I hope that we all can make great use of it. And the more that we can call out the industry for the obfuscation of the use of its unlimited resources, and the more we use our voices to call them out for it, then hopefully the sooner we can protect the public health, certainly of our children and of all of us. So thank you so much for having me.
Thank you, Meredith. And thank you everyone again for joining us today. So I am going to provide an overview of the website so you can all get a chance to see the layout and as well as some of the data that we share there. So first, I will actually take you to the tracker site. So this is the main web page. You can, of course, navigate to this page by typing in ash.org/tobacco-money. You can also navigate here from the ASH homepage by selecting our solution tab and scrolling down to U.S. Tobacco Lobbyist Tracker. So once you're there, you will see some of the summary data that Doug mentioned in his presentation. If you scroll down, you'll actually also have a link to the master set of data for all 50 states as well as Washington, D.C. And then below that, you'll see the interactive map, which I'll get into in a few minutes. And then below that area, you'll see some additional information, some more about the changes in data since the launch in 2021, which Doug briefly mentioned, as well as how advocates can use this tracker as a resource and some background on this project. If you scroll up to the top here, you'll also see some links to additional resources. If you click on this first link, you'll see a listing of the tobacco companies that were included in this research, and just a brief description of each one of those. You can click on the research methods and limitations, and it will describe what Doug spoke about earlier. If you click on the social media link, you'll see some sample social media posts as well as graphics that you can use on all of your platforms. And then the press release for this data update is also here. It's actually a really good resource because there are some high-level key data points that you can use in your social media post as well. And then finally, there is a link to provide us with your feedback. So we always welcome feedback from you on this tracker and how it can be useful. And if there are any areas that need improvement or additional information that you may have, you have two ways to provide that to us. You can click here to see an online survey and answer some questions and leave your comments. Or you can also email us at info@ash.org. So I will navigate back to my presentation just to show some of the data that you will see when you visit the state pages on the tracker. So the first thing that you'll see when you click into a state page is a spreadsheet, a snapshot of the spreadsheet of data that will come up for each state. It will include a list of lobbyist names. It will also include the companies that were identified, as well as the tabulation of registrations and individuals. Just want to note that if you look at this yellow row, this is where the individuals or firms are tabulated. And if you look at the blue row, that's where the individual registrations are tabulated. Those totals are then put in this box at the lower right-hand corner of the spreadsheet. And then if in some cases states have both individuals registrations reported on, as well as firms reported, you'll see the combined total for those at the top of the spreadsheet. So I'll go on to just show some examples of the differences that you'll see. In some states, again, like I mentioned, you'll see individual lobbyists are reported. And again, those individual names are listed here on the left-hand side. And then again, those totals are tabulated up at the top. In some cases, states report on the firms and not the individual names. So you'll again see those here and then the totals. And then in some cases, you'll see both. So again, you'll see the individuals reported in one spreadsheet, the firms reported in another. Those totals are at the right-hand corner of the bottom of the spreadsheet and then combined at the top. So I'll take you back to the website to just give you an overview of how that is displayed on this interactive map. So for example, if we click here on Kansas, it'll zoom into the state and you'll get a very top level summary of the information that's included in that data spreadsheet. So this is telling me basically that we were able to identify that Kansas had 13 individual lobbyist registrations reported. If you click the X, it'll zoom back out. I can click on another state like California and see that they do not have any individual lobbyist names reported, but they do report that they had 7 firm registrations. And then again, I'll click on Illinois, and they do report on individuals as well as firms. So you'll see those totals here. If I click the More tab, you will be directed to the state page. You'll see some information about the data that you're going to see in the spreadsheets below. And you'll get a little snapshot image. If you click on the image, you'll be brought to a larger view of the spreadsheet. So again, you'll see all the totals for the companies, the individual lobbyists or the firms, and then the combined total of individuals and firms up here. So I will go back and just wanted to point out that in some cases, you will also see that there are several lobbyists or firms that are registered for more than one company. And again, we tabulate the number of lobbyists that can be identified for that particular state, as well as the amount of registrations that they have. So the X denotes that they have more than one registration. And you'll see that displayed again in the totals at the top. So the state had 14 identifiable lobbyists, and they had 17 registrations, as these individuals had more than one. So going back to the site, I just wanted to show you one additional area. If you see this panel on the right-hand side, you can also click to go to any state. So you can choose to go to the state by the map, or you can choose to go to the state by clicking your choice here on the side panel. And again, you'll be brought to that state page, and you can click to see more detailed information. So that is a very quick overview of the site. We encourage you to go and explore, look at your state. Again, here's the URL, and we welcome your feedback. You can email us, you can fill out that online survey. And I just wanted to plug that we also have other resources available that talk about tobacco industry interference. One in particular is our Tobacco Industry Interference Index, which we release every 2 years. The last one was 2021, but we are going to release a new index later this year for 2023. Thank you all so much for joining us today, and I will hand it back to Kelsey.
Thank you to all of our speakers today. This has been really fascinating. I wanted to emphasize something that Annie said earlier. The word lobbyist isn't a bad word. There are a lot of lobbyists on our side and a lot of lobbyists doing great things for public health. So I just felt the need to put that out there just in case. Not all lobbyists are bad. Our Q&A is hopping here, so we've got lots of questions. There are a couple first on sort of technical matters on the tracker. So Doug and Nichelle, I'm going to ask you those quickly, and then we can move on to a little bit more of a discussion. But first, how often will the tracker be updated?
Yes, we have been updating the tracker every 2 years. Of course, we have limited funds to do this annually, and it is a lot of work. But we're hoping to, really expand on the information that's included on the tracker. Doug is actually working on some additional information on conflicts of interest. So please stay tuned for those updates.
And then the tracker has state lobbyists. Is there a list somewhere that includes lobbyists that target Congress/Washington, D.C.?
I believe you can find some of that information on the Open Secrets website. I know that they have some more details on the federal level. So I would definitely use that resource if you're looking for that information.
And then one more sort of technical one. Is there any consideration of adding cannabis or marijuana registrations to this resource?
We haven't looked into that specifically, but we're open to additional information. One of the things that we discussed when we talked to Annie preparing for this webinar was hookah. So those are areas that we will definitely explore adding to the map.
Great, thanks, Nichelle. Okay, I'm a lawyer, so I'm going to dive into one that's sort of my area of interest here. But is there any state that has a law or a regulation that former state employees or former elected officials cannot become tobacco industry lobbyists after they leave state service. Does anyone know anything about any registration requirements like that?
I don't, but I want to just raise something that I think is really interesting recently that's related, but it's at the federal level. Some of you may have heard that at the Reagan-Udall conference, I think a few weeks ago, Dr. Califf, the FDA commissioner, talked about how, every 2 minutes the industry is suing whenever they do something. And that so much of the time, he said, we're facing former FDA lawyers. And I know that at the federal level, I think there's like a 1-year garden leave if you've worked at FDA. You can't, or at any government agency, you cannot lobby the organization the agency that you worked for. I'm sure for someone like Matt Holman, who used to be FDA science director and then went to work for the tobacco industry, maybe he doesn't need to lobby, he can just hang out with his friends. But anyway, I don't know the answer at the state level, but I do think that what Dr. Califf said, his own frustration at that, so it's not exactly the same, was interesting.
Great, thank you, Meredith.
Yeah, I'm not aware of any at the state and local level. Any laws like that.
Yeah, I haven't heard of any either. I think they're a great idea though. Annie, I guess this one is sort of, oh, sorry, Nichelle, go ahead.
I was just gonna say, in our index report that we released, it is actually one of the recommendations we have, because it's one of the reasons that the US is scoring so low when it comes to tobacco industry interference. So yeah, I encourage everyone to read that index.
There's a question here, Annie, I think it's mostly for you, but anyone feel free to answer. Have you noticed cigar lobbying increasing over the past 5 years?
Great question. Yes, we've definitely noticed cigar lobbying increasing over the past 5 years. There have been some really strange exemptions and bills that contain some exemptions just for cigar use. And in some ways, premium cigar arguments have been well received by some legislators. They see it as, more expensive not cigarillos, but more expensive cigars should be exempted because they're, less likely to be used by kids. And frankly, often still smoked in some legislative offices. So yes, I think, we have seen that, and we've just seen the state legislatures a little more responsive and receptive to those bills to weaken it. So even in smoke-free cigar bars, I'm sure A&R would be able to speak to that. But yeah, but what we've noticed just as much is the increase in the hookah lobby. We've really gotten organized and really started kind of lobbying up. So I'd be really curious to see if you can add that to the tracker. It'd be fascinating.
I think this question sort of builds on that, and maybe Doug, you can start us off with this one. The question says, today there are hundreds of companies associated with e-cigarettes. How can lobbyists for each one be identified, especially when a company is not solely involved with e-cigarettes and there are so many of them?
Yeah, that's a great question. Our keyword list was not perfect, I'm sure, as has already been pointed out in the last couple of days. But we searched for vaping and VAP and other related keywords, and caught quite a few local organizations that were vaping store organizations. So I'm sure we didn't catch them all with the varying names. There's of course one group that uses smoke-free in their name that's actually pro-vaping. So we caught most of those with our keywords, but it's a really good point.
And Doug, if folks who are listening hear of something, can they know if one that you maybe didn't catch, could they contact you? Or what should they do? Yeah,
absolutely. That's really the idea behind the invitation on the website for feedback. It was kind of where that was prompted, because no sooner than the 2021 version had come out, there were a couple of people, including Dr. Cowan from Missouri, and a few others that identified some local examples that we didn't catch. So we really appreciate those.
Nichelle, I want to give you an opportunity to respond to this one. There was a mention of open secrets. Have you thought about combining money into this tracker? And they also mentioned that alcohol would be an excellent addition as well.
Yeah, actually, so we didn't want to be redundant in what we're reporting on, since Open Secrets is such a great resource, but it's definitely something that we could explore collaborating, perhaps even with them directly, to incorporate in our reporting. And on the topic of alcohol, it hasn't been something we've thought about for this, as we've stuck with tobacco products. But again, that's something we could talk about exploring.
There's another question that I think it would be good for everyone to weigh in on, and that's maybe we should evolve from referring to tobacco products to nicotine products, since products like puff bars are made from synthetic nicotine. So whoever would like to take the floor.
Well, I'll just say that I think that there's such a there remains for the average person when you talk about tobacco, and the more you talk about tobacco and make it clear that vapes are tobacco products and that these nicotine pouches are tobacco products, and the companies like Puff and the gang that tried to use the then loophole, which was closed last year when Congress, with bipartisan support with FDA at the table, gave FDA authority over synthetic nicotine. They can call themselves whatever they want. They can call themselves chewing gum, but those are tobacco products. So I think it's actually helpful. I mean, perhaps not everyone would agree, but I think it's helpful to capitalize on all of the heavy lifting that so many of the public health people who are in this work, doing this work so far longer than I have, and many of whom are on this call, all of the negative messaging that was put out into the world about tobacco is bad for your health. The more that we can use that to our advantage, these are tobacco products. Maybe they can be used in concert, because I think that there's still, I hope, or we hope, is a negative connotation for many people about tobacco. So they can tell us it's clean nicotine, but it's still a tobacco product, whether or not it is synthetic.
Any other thoughts on vocabulary choice? There's another question that's sort of leads into this, but are disposable vapes considered more harmful than ones you refill, or are they both considered just as dangerous? The question asks, I know disposables are thought to burn easier and carry more contaminants. Meredith, did you want to take that one?
Well, I guess I would say that I have not at this moment, I cannot say that I have read research that says that one is less bad than the other. We know it's all bad, and certainly it's all bad for kids. So I don't know the answer. I have not heard that, but I can't, I am not a tobacco researcher. I will be looking into that as soon as we hang up. Well, first I'm going to be on the tracker all day, but second, I will come back to you, but I don't believe so. So sorry, unless maybe some of my colleagues here know the answer, because I'd love to know that too.
Yeah, I haven't seen research to state that either. I do know that now disposables take up just about half the market, but the top two, Vuse and Juul, Vuse Alto and Juul, are still cartridge based. So we still have to worry about both.
Okay, I have one more question that I think will lend itself well to sort of some closing thoughts. So I'm going to let each person answer this one, and we can maybe just go in the order we spoke in. So the question is, in Vermont, many lobbyists who are working for Reynolds are also working for hospitals and health associations. This would seem like an obvious conflict of interest. The question becomes not just how to drag this into the sunlight, but rather how to most effectively do so. So panelists, what do you think is the most effective way to draw attention to this issue? Doug, do you want to start us off?
Well, you would ask me. I missed the main part of that question. I'm sorry. I was typing an answer.
Oh, no problem. What do you think is the most effective way to draw attention to tobacco industry lobbying?
Well, it goes, I'm kind of old school. It goes back to media advocacy. And this is a tool that can be used for that. You know, you've got some hard numbers that you can put out. You can quote a third, party. It doesn't have to be, your numbers. You can quote either you can verify the information on your own, make sure it's up to date on your own state's, registration website, or you can just cite ASH's tracker. And list where your state ranks and whether or not your state has transparency for even showing all the lobbyists by name. So there's lots of opportunities for media advocacy. The launch of the tracker will be one. The upcoming corrective statement postings in every community across the country, pointing out that these, every state has a racketeer at the table, in effect, with Altria having lobbyists in all 50 states and DC.
Thanks, Doug. Annie?
Yeah, I could try to answer the portion of the question that I think dealt specifically with Vermont and the fact that some of the lobbyists also lobby for public health groups and also lobbyists for. I agree, it's a complete conflict. As many public health organizations, including ours, have a policy that we don't hire lobbyists that have had past ties to working with the industry and lobbying for the industry. In some states, some smaller states like Vermont, it can be really hard to find those lobbyists that have never had, any tobacco industry clients or associated clients. So that, that's something that we've struggled with in a couple different states. But yes, getting back to sort of exposing it and how do we do it? I think we just want to make clear that, legislators certainly know who they're talking to. And, folks inside the dome, if you will, are really aware. Sometimes, folks lobby for a number of different groups. They may lobby for craft as well as, Juul. And so they can, they may be in there talking about one thing and not really identifying and exposing the fact that they are industry lobbyists. So it's just always, I think information, is power here. And so the new resource or the updated resources from ASH is going to be really helpful for everyone.
Thanks, Annie. Meredith, answer the question or
yeah, and I appreciate Rolf from Vermont asking that question, and he does a lot of deep dives. I mean, I know that he's shared a lot of really great resources with us that we have used when we've gone to recently to DC, looking at industry interference and influence and all that. So I know where he's coming from. I think we all do. And I'm just looking, there's something here, a quote from a 1992 Philip Morris document explained that, quote, public opinion and media coverage are only important insofar as they affect the government. We will never be liked, and what we want is to be ignored. So again, I think as Annie said, and as Doug said, also to shining a light on it. While and maybe, and I have no idea, maybe there are some states where I don't know, and I'm not an attorney. Is it a moral conflict of interest? Yes. Being a lobbyist is not the issue. We're talking about lobbyists who are working for the promotion of the public enemy of tobacco, and every lobbyist themselves will have to make a choice. So I think that what would probably be effective in the case that that Rolf is talking about is making sure that that legislators understand, if they're talking to someone about a different issue, that this person is also working for the tobacco industry, and perhaps that's information that could be effectively brought to light by calling out this moral conflict, if it's not a legal conflict in a particular state, with op-eds or letters to the editor, in addition to sharing that knowledge with individual constituents who may have interest in some of the things we're all working on, the anti-tobacco legislation, have a constituent, have someone go in and talk to legislative staff and say, we have some concerns. This is a lobbying firm that does both, or this is an individual, and we think it's important that you keep that in mind when you are working with them, because it's about the obfuscation, right? It's about what's not being said or what's not being identified. And again, that is what is so amazing about having this resource.
Great, thanks. Nichelle, final thoughts?
Yeah, I would just echo all of the sentiments that the other speakers mentioned. I would say that in order for us to really be effective, we need to be informed as advocates. And we hope that this tool is, helping us to be informed about who we're dealing with. We all know that the industry is pervasive, that they are not working in the interest of public health. So the more that we can do to just spread that message and really get people on board, the better in the end for all of our health. So I would encourage everyone to take a look at this tracker and really dive into that information. I would also encourage you to look at our index report because I think there are some really key messages on, what can we do to improve the interference interactions with our policymakers and what we can encourage them to do to make this less of an issue. So I thank you guys all for joining us today. And I'll hand it back to you, Kelsey.
Yeah, thank you so much to our panelists and to everyone who joined us today. I wanted to point out that ASH's next webinar will be on Thursday, July 13th. And it's about using data to amplify tobacco control advocacy. So it's a similar topic to this, and we hope all of you can join us for that as well. Thanks so much for coming today.